Hi medicos. How is everyone doing? I wish everyone a good day. Today, I will be talking about the axillary nerve anatomy for exams, which includes course, branches, and clinical tips. Axillary nerve is an important peripheral nerve in the shoulder region. It is a mixed nerve that supplies both motor and sensory functions to the shoulder. The axillary nerve arises as one of the terminal branches of the posterior cord of the brachial plexus, and the root value is C5 and C6. The given image shows the course of the axillary nerve. The dotted line represents that the axillary nerve passes behind the lateral cord from medial to lateral. What is the other terminal branch of the posterior cord of brachial plexus? It is radial nerve. Let's see the course of the axillary nerve. In the axilla, the axillary nerve is situated behind the third part of axillary artery and lies lateral to the radial nerve. Then, it leaves the axilla and runs along with the posterior circumflex humeral vessels through the quadrangular space. Please see the illustrations given below. The anterior view shows the course of the nerve, winding around the posterior part of the surgical neck of the humerus. On the other hand, the left illustration shows the course of the nerve, coming from anterior to posterior along with the posterior circumflex humeral vessels. See the purple square, representing the quadrangular space. Meanwhile, what is quadrangular space? It is an anatomical intermuscular space, situated concerning the scapular, medially and the upper one-third of the humerus, laterally. Because of quadrangular space, it has four boundaries. They are superior, inferior, medial, and lateral. Now what are the structures forming the quadrangular space? Superiorly, it is bounded by teres minor and a small part of subscapularis muscles. Inferiorly, related to the teres major muscle. Medially by long head of the triceps, and laterally by the surgical neck of the humerus. Now coming back to the course of axillary nerve. The axillary nerve's main trunk, while passing through the quadrangular space, gives its first branch to the shoulder joint, the articular branch. See the dotted line in the illustration showing the articular branch to the shoulder joint. Then, it divides into anterior or superior, and posterior or inferior branches. Now I will discuss these branches individually. First we'll see the anterior branch. Anterior branch of the axillary nerve accompanies the posterior circumflex humeral vessels that winds around the posterior surface of the surgical neck of the humerus, but undercover of the deltoid muscle. This image is for your understanding purpose. See the quadrangular space. The anterior branch supplies the deltoid muscle, which is powerful abductor of the shoulder joint. In addition to the muscular branch, it also provides few cutaneous branches that supplies the lower part of the skin over the deltoid muscle. This area is called the regiment badge area. See the image for understanding. Now coming to the posterior branch. The posterior branch runs medially and supplies the teres minor. In this situation, I want to add a peculiarity to this branch. This posterior branch, before supplying the teres minor, shows a pseudoganglion, has no nerve cells, but nerve fibers are present. I want to ask a question. Is there any other nerve in the body that contains pseudoganglion? The posterior branch also gives a sensory branch called upper lateral cutaneous nerve of arm, the name itself indicating that it supplies the skin of the upper lateral part of the arm. Now the course of the axillary nerve is completed. Once again, I will brush up the branches of axillary nerve. Number 1, muscular branches to deltoid and teres minor. 2, articular branch to shoulder joint. And 3, cutaneous branches to skin over the lower part of the deltoid muscle, that is, regiment badge area and upper lateral part of the arm. Now what are the actions responsible by axillary nerve? 1. Teres minor muscle is responsible for the lateral rotation and adduction of shoulder joint. 2. Deltoid muscle is an important muscle of the shoulder joint that performs various actions or movements on it. The anterior fibers are responsible for flexion, adduction and medial rotation of the shoulder joint. The middle fibers are powerful abductor of the shoulder joint that abducts the shoulder from 15 to 90 degrees. Finally, the posterior fibers are responsible for the extension, adduction, and lateral rotation of the shoulder joint. Now the formation, course, branches and distribution of axillary nerve is completed. What next? Yes, the clinical anatomy of the axillary nerve. Axillary nerve lesion or injury. The etiology is shoulder dislocation, humeral surgical neck fractures, and compression during improper clutch use. Now what are signs of this nerve lesion? Weakness in shoulder abduction, loss of sensation in lateral part of arm, difficulty in lateral rotation of the arm and frozen shoulder. Okay, a lesion happened. How to diagnose an axillary nerve injury? 1. Physical examination, identifying the weak shoulder abduction and loss of sensation. 2. Electromyography, the EMG or nerve conduction study, for evaluating nerve functions of axillary nerve. And number 3 is ultrasound to visualize the axillary nerve for the injury. Next. What is the treatment options for the axillary nerve lesion? 1. Rest with physical therapy for minor injuries. 2. Application of ice pads. 3. Administration of non-steroidal anti-inflammatory drugs. 4. Local steroid injections with more severe symptoms. 5. Pain medications. And 6 is surgery in the form of nerve grafting or decompression or neuropathy is adopted in severe cases. Next, what is the recovery of axillary nerve? 1. Minor injuries often recover in 6 to 12 weeks. 2. Severe injuries may take longer, with potential permanent deficits. Next, how to prevent it further. 1. Avoid prolonged pressure on the axillary pit. 2. Reduce the risk of shoulder dislocation or falls. 3. Proper education for the use of crutches. 4. Ensure adequate cast or splint fit. Final twist. Have you heard about Hilton's law? Hilton's law states that a nerve that supplies a joint also innervates the muscle and the skin overlying that joint. The question now is whether the axillary nerve will obey the Hilton's law or not. Of course, yes. Because of this relationship, the overstretching of the lower portion of the shoulder capsule during abrupt overabduction is minimized by the reflex inhibition of the deltoid through the axillary nerve. Dear medicos, hope you all understand about the axillary nerve. I will meet you once again in another interesting video. Please like my channel, comment, share, and subscribe. Good day all.